Alzheimer's disease is a neurological disorder that affects the brain and causes memory loss. The exact cause of Alzheimer's disease is still unknown, but it is believed to be a combination of genetic, lifestyle, and environmental factors. Common symptoms of Alzheimer's disease include forgetfulness, confusion, difficulty with problem solving, and changes in behavior. Diagnosing Alzheimer's disease involves a thorough medical evaluation, including cognitive tests, brain imaging, and blood tests. While there is no cure for Alzheimer's disease, there are treatments available that can help manage the symptoms and slow down the progression of the disease. Medications such as cholinesterase inhibitors and memantine are commonly prescribed to improve memory and cognitive function. Non-drug approaches like cognitive stimulation, physical exercise, and social engagement can also be beneficial for individuals with Alzheimer's disease. In advanced stages of the disease, individuals may require assistance with daily activities and may need to live in a specialized care facility. It is important for caregivers and family members to provide emotional support and create a safe and supportive environment for individuals with Alzheimer's disease. If you or someone you know is experiencing memory problems or other symptoms of Alzheimer's disease, it is important to seek medical advice for an accurate diagnosis and appropriate care.
Causes. The exact cause of Alzheimer's disease is not fully understood, but it is believed to be influenced by a combination of genetic, environmental, and lifestyle factors. Some common factors include genetics. Family history of Alzheimer's increases the risk. Certain genes, such as ApoE4, are associated with a higher likelihood of developing the disease. Age. The risk of Alzheimer's increases with age, and the majority of cases occur in individuals over 65. Brain changes. Alzheimer's is characterized by the presence of abnormal protein deposits in the brain, including beta-amyloid plaques and tau tangles. These deposits disrupt communication between brain cells and lead to cell death. Cardiovascular health. Conditions that affect the heart and blood vessels, such as hypertension, high cholesterol, and diabetes, may contribute to Alzheimer's risk. Lifestyle factors. Poor diet, lack of exercise, smoking, and other lifestyle factors may also increase the risk. Symptoms. Alzheimer's disease progresses slowly, and symptoms may vary, but common signs include memory loss. Forgetting recently learned information is a hallmark symptom. Difficulty performing familiar tasks. Routine tasks may become challenging. Language problems. Individuals may struggle with finding the right words or following a conversation. Disorientation. People with Alzheimer's may become lost in familiar places. Poor judgment, decision-making, and problem-solving abilities decline. Changes in personality and behavior. Mood swings, irritability, and changes in personality may occur. Diagnosis. Diagnosing Alzheimer's disease involves a comprehensive assessment, including medical history, a thorough history to understand symptoms and their progression. Physical and neurological exams, to rule out other possible causes of symptoms. Cognitive tests, assessing memory, language, problem solving, and other cognitive functions. Blood tests, to rule out other potential causes of cognitive decline. Imaging studies, MRI or CT scans to identify structural changes in the brain. Genetic testing. In some cases, genetic testing may be recommended. Treatment. While there is no cure for Alzheimer's disease, treatment focuses on managing symptoms and improving quality of life. Common approaches include medications. Cholinesterase inhibitors and memantine are commonly prescribed to manage cognitive symptoms. Therapies, occupational therapy, speech therapy, and other interventions to improve daily functioning. Supportive care, providing a supportive environment and addressing safety concerns. Clinical trials, participation in research studies for potential new treatments. Lifestyle modifications, healthy diet, regular exercise, and mental stimulation may help slow cognitive decline. It's essential for individuals experiencing memory or cognitive issues to seek medical attention promptly for an accurate diagnosis and appropriate management. Early intervention can help improve outcomes and quality of life for individuals with Alzheimer's disease. Prevention: Alzheimer's disease. Alzheimer's disease is not something that you can prevent. However, there are a number of lifestyle factors that can increase your risk of developing the condition, such as eating a healthy diet, exercising regularly, and avoiding risky behaviors. Alzheimer's disease and other disorders that cause dementia can be avoided by following a heart-healthy lifestyle. Some lifestyle choices that may reduce the risk of Alzheimer's include the following: exercising regularly. Eating a diet that is made up of fresh produce, healthy oils, and foods with low saturated fat will make him healthy. Follow the guidelines for managing high blood pressure, diabetes, and high cholesterol. If you want to quit smoking, you should talk to your doctor about it. Engaging in activities that require mental and social engagement is beneficial for later life thought skills and reducing the risk of Alzheimer's disease. Coping and support. People with Alzheimer's disease can experience a variety of emotions, including confusion, frustration, anger, fear, uncertainty, grief, and depression. If you are caring for someone with Alzheimer's, you can help them cope by being there to listen and provide reassurance. You can also help the person retain their dignity and self-respect. Having a calm and stable home environment can help reduce behavior problems. If a person with Alzheimer's is made to deal with new situations quickly or is asked to do complicated tasks, this can cause anxiety. As the ability of someone with Alzheimer's to think clearly decreases, they may become upset. More is needed to do the task.
Rehabilitation of the brain, often referred to as neurorehabilitation, is a broad field that focuses on restoring or improving the functioning of the brain after injury or illness. This could include conditions such as traumatic brain injury, stroke, neurodegenerative diseases, and other neurological disorders. The goal of rehabilitation is to help individuals regain lost skills, adapt to new challenges, and improve their overall quality of life. Here are some key aspects of brain rehabilitation. Multidisciplinary approach. Neurorehabilitation often involves a team of healthcare professionals, including neurologists, physical therapists, occupational therapists, speech therapists, psychologists, and rehabilitation nurses. A multidisciplinary approach ensures that various aspects of the individual's physical, cognitive, and emotional well-being are addressed. Physical rehabilitation. Physical therapy focuses on improving mobility, strength, and coordination. Occupational therapy helps individuals relearn daily living skills, such as dressing, cooking, and grooming. Rehabilitation exercises are designed to promote neuroplasticity, the brain's ability to reorganize itself by forming new neural connections. Cognitive rehabilitation. Cognitive rehabilitation targets cognitive functions such as memory, attention, problem-solving, and executive functions. Cognitive exercises, puzzles, and activities are employed to stimulate and strengthen cognitive abilities. Speech and language therapy. For individuals who experience speech and language difficulties due to brain injury or stroke, speech therapy is crucial. Speech therapists work on improving communication skills, language comprehension, and swallowing functions. Psychological support. Dealing with the effects of a brain injury or neurological disorder can be emotionally challenging. Psychologists and counselors provide support and coping strategies. Cognitive behavioral therapy may be used to address mood disorders or emotional challenges. Assistive technologies. Technological advancements play a significant role in brain rehabilitation. Assistive devices and technologies can aid individuals in compensating for lost functions. Virtual reality, VR, and augmented reality, AR, are increasingly being used for immersive and interactive rehabilitation experiences. Community reintegration. Rehabilitation extends beyond the clinical setting to help individuals reintegrate into their communities. Support groups, vocational rehabilitation, and community-based programs assist in the transition back to daily life. Medication management. In some cases, medications may be prescribed to manage symptoms, control seizures, or address other specific issues associated with the neurological condition. Patient and family education. Education is a crucial component, helping patients and their families understand the nature of the brain injury or disorder and the rehabilitation process. Empowering individuals with knowledge promotes active participation in their own recovery. It's important to note that the specific rehabilitation plan will vary based on the individual's condition, the severity of the injury, and their unique needs and goals. Early intervention and ongoing support contribute significantly to the success of brain rehabilitation efforts.